Noswaith dda I gyd a croeso i'r bwrdd. Good evening, and I'm pleased to welcome you to the annual general meeting of the Aneurin Bevan University Health Board for the financial year 2024-25. Today's meeting is being held in public, which means that we are being joined by our staff, our stakeholders, and the members of our community. And thank you ever so much for being here today, and to those of you that have submitted questions in advance. The meeting recording will be available on our YouTube channel after the meeting if anybody wants to watch it again. 2024-25 was a very, very challenging year. Our staff have sustained really high levels of pressure and increasing demands. But I'm very proud to announce that there continues to be exceptional collaboration, determination and ambition to improve our services and their effectiveness for our population across all teams, for which we are really truly grateful. It has been very helpful to see the improvement in outcomes for patients, which are the most important things for us. We know more needs to be done in terms of access and accessibility, but nevertheless, the strides that our staff and their teams have taken have really shown benefit this year. And I hope that within our annual report, the exceptional achievements of individuals and services to ensure ongoing delivery and improvement throughout the year, despite the challenges, can be seen quite well and clearly. However, we are very mindful of the challenges in delivering timely care and treatment for our population, and we and the teams are working extremely hard to improve access. We know how frustrating it can be, but we really want to ensure that people can remain fit and healthy and get really good access to care when they need it. Later in the meeting, we will welcome questions from those of you who have joined us. We have had some questions submitted already, and thank you very much for those. However, you can continue to submit questions throughout the meeting using the question, answer and facility on Teams. When we come to the items for questions, I shall invite those who are with us to ask their questions to the relevant board meeting, and I'll give them to the relevant board member. We'll respond to as many as we can, and for those that we can't get to today, we will of course provide a written response to all questions in the coming days. We're very pleased to see you with us, and we do hope that you will find this annual general meeting helpful and purposeful. I'd like to hand over to Nicola Prigodich, our Chief Executive, who will present the highlights of our performance during this difficult year. Thank you, Nicola.
Diolch, Chair, and noswaith dda, everyone. Good evening, and great to see all of you on the meeting today. So hopefully, if you've had a chance to see the annual report, it's got lots of information in there, but I'm just going to draw out a couple of headlines for the organisation, and then just take you through some of the headlines for each of our programmes of work before we hand over to the finance section. So if you go to the next slide, please, down and again. So our overall mission has been to reduce health inequalities by improving population health. We know across our communities we've got big variations in health between our populations and our communities, and we are striving to improve the health of the whole of the population. So if I go into some of the key achievements, particularly for 24-25, and these as very high level, but hopefully captures the progress we're making as a health board. So first of all, we continue to have a relentless focus on the quality and safety, patient experience and outcomes of our patients and our communities. And one of the kind of key system-wide metrics is something called Risk-Adjusted Mortality Index, otherwise known as RAMI. This measures in-hospital mortality and is often a really good metric about the progress you're making across the hospital system. And we have the lowest RAMI in Wales and continue to run below the Welsh average now since the Grange Hospital in particular was opened, demonstrating the improved safety and outcomes of the acute end of our system since we've opened. There's many other quality metrics that we measure, but we thought that one is a really important one that we measure alongside crude mortality, which is also going in the right direction. We have reduced, Anne mentioned, very long waits. We have got a relentless focus on this as well. It's a big priority for the Welsh Government also. And we've reduced the people waiting over 3 years down to 0, which we've been working hard to do. And we've significantly reduced the 2-year wait position, which I'll come on to as well. And we've only got 3 specialties pretty much left that have got 2-year waits. Most other specialties have got waits much lower than that. So we focus on those 3 specialties in particular, and they are ENT, orthopaedics and ophthalmology. On the back of the ophthalmology, we've been the health board lead across the South East Wales region to reduce the 2-year waits for cataracts. We've been working with private providers on the back of additional funding from Welsh Government to remove all 2-year waits for cataracts. And we're continuing with more work this year as well to continue with that progress. We want to make sure that we don't just concentrate on treating people when they present to hospital and to our health services, and prevention is really at the heart of what we do. And our public health director and her team have done huge amounts of work on preventable premature mortality. We know there are people who die earlier than necessary, and they are avoidable. So lots of work going into those particular work streams, and women's health is also emerging as a key priority for us. Mental health, we've seen some significant improvements around access targets, with us delivering the 80% of patients assessed and treated within 28 days for both adults and children, which is really good progress from where we were over 12 months ago. We've had a greater focus on finance and efficiency. We were facing some significant financial challenges 2 years ago, and we delivered our financial target. We secured some additional funding as well last year and ended the year with a £7 million revenue deficit, which was much better than what we predicted at the beginning of the year. We've done huge amounts of public engagement to inform a new organisational strategy. It's due to be launched now in the autumn, called Better Health, Better Care, Better Lives, and really does build from the work we've done on clinical futures into a much broader strategy that looks at the prevention and population health end as well. We'd already opened the Bevan Health and Wellbeing Centre in Tredegar, so we were pleased to open the first phase of the 19 Hills Wellbeing Centre in Newport. This is part of us building our community resilience, so that was great to see, and we've got more work going on around these wellbeing centres in the future. Our workforce is a really positive story as well. So despite we know the workforce is a challenging area, we increased our substantive workforce by over 200, and they were all pretty much in the clinical areas, more doctors, nurses, therapists. We reduced variable pay by a further 16 million and reduced particularly on agency workers. So really helping us build those sustainable teams, and we reduced turnover. So that means less people are choosing to leave the health board and staying with us, which is really positive as well. And then the final point on here is we are keen to capture patient and public feedback, and we've been using a new system called Civica. It's got much more potential to be used more widespread, but our latest patient satisfaction ranges between 87 to 90% fairly consistently. And then where there are lower than those numbers, we are targeting the areas of improvement to make sure we listen, learn and respond to that feedback. So that was a very high level achievement, but I think we all know it's not all easy and not all good news, because we've got lots of challenges that we continue to face. And as I've just mentioned, so whilst we've got some really positive workforce metrics, maintaining the morale of our workforce during these challenging times is particularly difficult, and we work really hard on our well-being and workforce. We have got a people plan. We just signed off the new people plan today to make sure we look at all aspects of our workforce plan. And so we've got some hotspot areas where we still struggle to recruit, and we rely on temporary staff. We continue to see rising complexity of patients and increase in demand. We've recently been talking about another 25% increase in cancer referrals, in the last year, and this is on top of us seeing almost a 40% growth in cancer referrals since pre-pandemic. So we, outpatient referrals, cancer, demands for certain maternity care are all going, in an increasing trend that we are trying to keep up with. Our estate presents a number of challenges. Whilst we are benefited from some capital with some really positive, some brilliant estate, we know we've still got a number of facilities that are not really fit for purpose, and we are continuing to look at how we manage those. Alongside digital, we know we need to invest much more into our digital, and we need the capacity and the resources to do that and the time. So digital continues to be a challenge and an opportunity. Considerable pressures on our system during last winter, and we will be looking back at how we can do things better this winter, but we know the demand on our system during winter was excessive last year, and we need to make sure we're as prepared as possible. And I'll come on later to the importance of vaccinations. And then we've talked about money, but whilst we did well last year, the financial context continues to be hugely challenging. We do still have a lot of funding on a short-term basis, and trying to maintain financial balance is a continued challenge for us when we are trying to meet all of the demands. So that's a very short kind of summary of our achievements and challenges at a very high system level. What I was going to do now is just take you through, we got 5 under our 3-year plan, we've got 5 priority programs that we focus most of our improvement work under. So I'm just going to give you some headlines against each of those 5 programs. So the first one is about embedding prevention and population health in all that we do. Again, lots of progress across this agenda, but I'm just going to pull out a few of the bullet points that are on this slide. We've been to diabetes. We've got one of the highest incidence of diabetes in our Gwent communities. We know it consumes huge amounts of resources of our health system. So we are doing lots of work around the prevention model, and we are running that in 6 areas now across 3 of our neighbourhood care networks. And we're also making sure, working with GPs, that they are undertaking all of the care processes that they should be doing. We've also, the Director of Public Health has led a piece of work where we've got a hypertension case finding programme. This is to do kind of checks for the community to identify high blood pressure that hasn't been detected, and this can have a really positive impact on strokes and cardiac disease. So we're in the early stages of that, but that will be a key. We're building that programme up during this year. There's been a big piece of work on the best start in life and understanding the needs of our children. Children and young people are a key priority for us, and we know the importance of those first 3 years of life as well in particular. So lots of work going on around the best start in life. And women's health I mentioned, so there's a lot of work going on around the Women's Health Plan, and our work continues to address vaccine inequity, but also vaccine promotion. So we know there's lots of national discussions about vaccines, but all of the evidence shows us the impact of not having a sufficiently vaccinated population and what that does. And we're particularly focusing on children's vaccination. We've been recently promoting measles, and we are getting ready for the winter vaccination programme, where we've seen the impact of lower than average vaccinations last winter in terms of people presenting to our system with respiratory conditions. So please, it's a plea from us that please get your winter vaccines. Okay, so if you move on to the next programme, which was about progressing place-based care models and sustainability in primary and community services. This is where most of our health interactions happen. We have around 3 million appointments every year to GPs, 13,500 GP appointments happening every day across Gwent. So this is an area, but we know that the feedback is it's not enough. People need more access to GP or GP equivalent services. So this is an area we continue to focus our efforts. So we have increased our core access standards. We also look at what community pharmacists, for example, can do. So we've the common ailment scheme is available in all our community pharmacies, and there's a list of conditions that you can now go to your pharmacy for instead of needing to go to the GP. We've exceeded our plan for general dental services. So again, we know dental services is a very topical issue at the minute. You might have heard the news yesterday about a new dental contract, but we concentrate on making sure our patients can access dental services. And also there's lots of work going on around ophthalmic diagnostic and treatment centres, particularly around glaucoma. So again, where people don't need to come into hospital for ophthalmology treatment, we optimise what can happen in your local opticians, etc. So lots of good progress, but this is an area we're continuing to try to do more and more of to avoid people needing to come into hospital. And it's much closer to where people live as well. Okay, the next programme is around urgent and emergency care system. This is very much where we talk about ambulances, emergency departments, delayed discharges, etc. So there was a huge amount of work last winter called the 50-day challenge. This was about us working with local authorities, social care, to reduce the number of people who are delayed in hospital. And we've seen about a 30% reduction, and we've continued to see further reductions since the end of March as a result of the work we've been doing in the health board and in partnership with local authorities to try to reduce the length of time people are delayed and the number of people who are delayed in hospital unnecessarily and all the risks that come with that. We've also made some progress around reducing our ambulance handover delays. We know this is a top priority for us as a health board, and we have still seen unacceptable ambulance waits, particularly over the winter. But we continue to work hard on this, and there's a number of initiatives that we've put in place. And I know I've got a question later where I'll fill in a bit more details around additional staffing, additional capacity, a new waiting room, and the work we are doing at the minute to try to make sure nobody waits on an ambulance for longer than 45 minutes. And we have definitely seen signs of improvement in this area. The other one is around patients spending more than 12 hours in the emergency department. This has improved consistently throughout last year, still more than we want and would expect, but we do consistently are either the kind of highest percentage of people being seen within 12 hours across Wales in this particular metric. In addition to the one underneath 4 hours, we've got an important target that people are admitted, transferred or discharged within 4 hours of arriving at the emergency department. We consistently between 75 to 77% when you look at our minor injuries and the majors at the altogether, and that again is consistently the best performance in Wales because our minor injury unit model works really well, where we've got people, almost all patients get treated and seen within 4 hours in those minor injury units. And then obviously the majors patients who go to the Grange will take a bit longer. And we've also tried to then continued to look at respiratory models, ambulatory pathways, and more extended hours for community resource teams to try to avoid people having to come into hospital where there's alternatives available. So lots more work to do on this, as you can see, but we are making progress in the right direction on this agenda. And the next one is around cancer and planned care. So cancer continues to be a top priority for us as the health board. We know how important it is. We have about 45,000 referrals a year now for suspected cancer, and only around 10% of those will end up with a cancer diagnosis. So about 40,000 people a year will be referred, and we pretty much 90% of those get a diagnosis within 28 days, which is so important for us because we know how much of a worrying time, when that uncertainty is hanging over you. And then if you have got cancer, trying to get people treated within the 62-day target. We're trying to get to 75% of that 62-day target. The highest we've had in the past 2 years was at the end of March at 67.5, and lots of work going on to try to address some of the backlog and the challenges. There's particular tumour sites that we particularly challenge in urology, lower GI, more like the stomach area, are some of our most challenged cancer tumour sites, with some of them absolutely achieving the 62-day target. I mentioned we've reduced the patients over 3 years. The number of patients waiting over 2 years at the end of last year came down from 4,000 to just under 300. And again, we're desperately trying to get that to zero. We are currently working with Welsh Government on securing some additional funding. Diagnostics, and particularly radiology and endoscopy, we've got the best diagnostic performance in Wales in terms of those treated within 8 weeks. More than 95% of patients were seen within 8 weeks in radiology, and endoscopy made significant improvements as well. And we can do lots of work around theatres and outpatients to make sure we're maximising the capacity that's available to us to make sure we can get more patients through. And then the final priority programme I'm going to draw out is around mental health services. Again, a really important area for us. As I mentioned, so adults and children, we had a big backlog of patients waiting to be assessed and treated, and we weren't hitting that 28-day target at the beginning of 24-25. But by December, we'd reduced our waiting lists from over 1,300 to under 600 for adults, and children's was almost completely eliminated. So really great progress. And also in terms of our CAM service for neurodevelopmental assessment, this is a hugely challenging area for all health boards in Wales, with a target of 80%. And for the first time, we managed to get 80% of our children seen within 6 months at the end of March, and we are pretty much sustaining that position. And some really, great working with schools, the local authority, as well as health colleagues together. We really are trying to do joined up care, and a lot of other health boards are coming to look at the work we've done in Gwent, because we really are trying to make this, trying to really lead the way around this really important agenda. And we're also undertaking a new mental health strategy for the future to really try to make sure we've got the services right in terms of what's offered in the community, and then when people are in crisis and so on. So there'll be more to see on that over the coming months and years. So that's the end of the priority programmes. Obviously, there's so much more around the work we've been doing on the quality improvement, the digital agenda, the research and innovation, decarbonisation. I could have a slide on all of those, but there's much more information in the annual report that you can look at your leisure. But hopefully that gives you a flavour of some of the key progress we've been making across the different programmes of the Health Board. And thank you for listening, and again, happy to take any questions at the end of the session. Thank you, Chair.
Thank you, Nicola. That was really very helpful, and it's just a very, very brief overview of the progress that we have made, and also a recognition of the additional steps that we need to take during this year to improve further. But I'd like to ask now for Rob Holcombe, the Director of Finance and Procurement, to present the financial accounts for the last year.
Thank you, Chair. Good evening, everyone. If we can move on to the first slide, please. This is a review of the financial statements for 24-25, which are subject to audit by the Auditor General for Wales, and they were signed off in July. In terms of the review by the Auditor General, that confirmed that their accounts provided a true and fair view and were properly prepared. So that's an unqualified audit opinion. However, we then did receive a regulatory qualification or opinion on our performance because we did not achieve financial balance, and we've got an overspend for the 3-year period 22-23 to 24-25. So on the basis of our governance, that means we've breached our resource limit, and hence there was a qualification on a regulatory basis. Next slide, please. So in terms of our financial performance indicators, they're presented in the table. I'll draw out some key points. So our revenue resource limit is basically the money we spend every day on delivering operational services. And for our funding of £2 billion, we achieved a deficit for 24-25 of £7.1 million, which is about 0.3%. And that's reflective of spending and cost pressures predominantly in things like drugs, specialised services, and managing some of our service pressures and demand pressures during the year. Second key one is our spending against capital resource limits, which again is living within our means and the resource spend set by us, and we achieved that, spending £66 million. Third one is paying out creditors. So a public sector payment policy of paying creditors within 30 days, and we achieved a 97% compliance of that, or just over, against a 95% target. And that basically means we are paying our suppliers as quickly as we can within that 30-day target. And then in terms of our cash holding, at the end of the year, we held £4.8 million, and that's within the £6 million limit established by Welsh Government for us. So I can move on, please, to the next one. So how do we spend that funding? So in terms of the 2 billion funding we've got, there was an increased spend of about 6% during 24-25, and that spent on our 595,000 population who we're responsible for, and resulted in a spend per head of just over £3,000 per head, which is actually the second lowest spend across all health boards in Wales, which would indicate a level of efficiency. So where did we spend our funding? So it's cut in this slide into three different areas. So primary healthcare, which is reflective of our investments and our services through GPs, our out-of-hours services, dentists, pharmacists and optometry services in the community. And we spent £352 million in 24-25, was an increase of 27 million. Moving then on to other healthcare that we have purchased with either through other NHS providers or private providers, and we spent £527 million on that in the year, an increase of 18 million. And that's very much reflective of increase in new innovative services through our specialist services investments, but also quite a significant investment in terms of external providers helping to reduce waiting times for patients across Aneurin Bevan Health Board's area of responsibility. So again, looking to improve our performance and services and access times there. And then thirdly, hospital and community services. We spent nearly 1.2 billion on those services, an increase of 72 million. And this is reflective very much of our own hospital provision and services in the community hospitals, etc., within the Aneurin Bevan Health Board area. Notable growth areas are drugs, both in terms of prescribed drugs that people receive through their GPs, but also specialist drugs through our hospital services. We've had increase in cost of staff through pay awards and increased contributions during the year on pension scheme. So if we go to the next slide, please. So in terms of our pay performance, we spent £888 million on pay in the year for our workforce. That's an 8% increase. And if you remove the pay award inflationary impact, our overall staff costs increased by £13 million. However, on a positive point, we did reduce our agency staff costs by an associated £13 million. And this is linked to our strategy of trying to make our services sustainable. And our investment in pay and workforce, alluded to earlier by Nicola, includes an extra 200 more nurses and allied health professionals being employed, a reduction in variable pay, but also a reduction in some of our back office, administrative and estate staff. So shifting the resources into more direct patient care in relative terms. If I can move on to the next slide, please. So this slide reflects the capital investment that we've made as a health board. The top table represents some of our more significant estates investments. So we've brought online Tredegar, the Bevan Health and Wellbeing Centre, 19 Hills, Newport East Health and Wellbeing Centre, that's based in Ringland. Neville Hall Satellite Radiotherapy Unit, that's linked to Velindre, quite a significant investment there and a high profile service there. Grange, we've invested significantly in extension of the ED department, and we were able to buy out and purchase the head lease for Chepstow Community Hospital, which used to be a public finance initiative scheme. So we were able to secure that and keep ownership of that and keep that service available for the community. A lot of our expenditure goes on equipment and making sure that our equipment and our other existing buildings are in a state of repair for safe services and delivery. And you can see that's quite a significant figure there in terms of where we spend. So next slide, please. So this slide hopefully is quite useful in terms of, so what services do we provide to our patients through the £2 billion funding we get? So I won't read the full, what I call the daisy, but in terms of where we spend our money, so we've got over 13,000 staff, nearly 14,000. That's employed staff. We deliver 71,000 inpatient treatments, 53,000 day cases, 920,000 outpatient appointments, 1,000 continuing healthcare placements, 3.5 million GP attendances, 555,000 bed days, and 17 million prescribed items. So just thought that would be a useful slide to give a feel of the scale of our operations and what we deliver for patients. So if I can move on to the next slide, please. Next couple of slides are related to our charitable funds. Aneurin Bevan Health Board is the corporate trustee for the charity, which operates for public benefit for the purposes relating to the NHS. The board is responsible for the governance and compliance and delivering the duties of the charity. These accounts and figures have not yet been audited. They'll be audited towards the end of the year, ready for submission to the Charities Commission. And the benefits of the resources we receive within the charitable funds are generally directed to staff and for patient benefits. So I'll go to the next slide, please. So during 24-25, we received £876,000 of income. That's an increase on the previous year, but our donations have actually fallen, which is reflective really of the economic situation and being experienced by the wider charitable fund sector in terms of donations. However, our income did increase through activities of training and income generation and through investment returns. So a positive picture in terms of overall growth on the income available to the charity. I'll go to the next slide, please. So as I said, most of our funding goes on staff or patient benefits, and that can be in terms of refurbing staff rooms or services and environments for patients when they come into hospital. Significant expenditure this year, an increase of 11%, which is reflective really of the committees, the Charitable Funds Committee's efforts to try and utilise the funding and get the benefit of that rather than be sat on and held back. We've spent nearly £500,000 supporting patients, and particularly things like dedicated staff for bereavement support and services, something that wasn't there before, and we've been growing that, and that's really helping the experience of patients and families. And then nearly £400,000 in terms of equipment, which supplements our existing equipment that we will fund through normal routes, but things like defibrillators in the cabinets in the community linked to Jack's Funds appeal, bladder scanners and other machines to help the service have that improved and enhanced offering really above our core spending. As I say, the investments are very much focused on staff and patient benefits, and the audit of these accounts will be done in December. Thank you.
Thank you, Rob. Thank you very much for that good overview of the use of our resources in the Health Board. I'd like now to ask Hannah, who is the Director of Strategy Planning and Partnerships, to provide us with an overview of the challenges and the priorities for the Health Board in this current year and beyond. please.
Diolch, Chair, and good evening, everybody. I'd just like to give a high-level overview of our current plan. We've looked back at our successes and challenges from last year. In terms of the plan for, sorry, next slide, please, if that's okay.
Sorry, Han, just before we move on, just wanted to remind people that at the top of their screen, they can see a Q&A tab. And if anybody wants to ask a question that we'll address in the next section of the meeting, they can click on that tab and type their questions so that we have them ready to come to.
Okay.
So if anyone does think of them, that is available for them. They don't have to, but that is a way to submit a question ahead of section 5. Sorry, Han.
Thank you. No, that's helpful. Thank you.
That's okay. Thanks, Dan. So our plan, our integrated medium-term plan for this year, which is our 3-year plan, 2025 to 2028. You'll find it on our website with the detail. There's a lot of detail in there in terms of our ambition and our quantifiable kind of metrics where we're aiming to deliver this year. But in line with our strategy requirements, we did develop a balanced integrated medium-term plan for this 3-year period. The plan was approved by the board and then was subsequently, in line with requirements, approved by the Cabinet Secretary, which is the first time in a number of years. So demonstrates the progress we're making in planning in the context of balancing management of our risks, delivering and improving patient outcomes and patient experience in terms of improved waiting times, and progressing on a number of strategic fronts. So it's a really positive for the organisation in that respect in terms of having that Cabinet Secretary approval for this year's plan. I'll move us on to the next slide if that's okay, to kind of delve into some of the priorities and opportunities. And they do build on and follow on from the updates that Nicola gave in terms of last year's plan. And so some themes you'll see coming through. It's important we give that and have given that continuity to the organisation and stakeholders in terms of our direction of travel and priorities. So we're using the 5 system change areas, and I'll just pick out a few specifics of what we're focusing on for this year in terms of making progress. In terms of the prevention agenda, Nicola's already touched on the really focused work we're doing around vaccinations. That has run into this year with us starting now in terms of preparation for the winter period. And the agenda around diabetes continues into this year, focusing on some key areas and the whole pathway, not just treating the symptoms and complications of diabetes, but really getting upstream and supporting people, ideally avoiding then, if possible, reversing the effects of diabetes. On our place-based care and primary community care agenda, we are working with partners really closely in terms of collectively looking at our joint assets, so our joint, whether they be buildings or teams or services we have, and really targeting how we can use those and work better across those services to support people, keep as independent as possibly in their homes and in their communities. An example of this is how we're building on models of multi-professional, multidisciplinary teams out in communities that have identified individuals or populations at higher risk and are doing proactive management of those individuals to really help them and support them keep well at home. In terms of our urgent and emergency care agenda, Nicola touched on this in terms of last year. Key things for us focusing on this year is realising and delivering some of the changes we started last year. So we have opened a new transfer lounge in the Grange, which is really enabling us to support patients move from the Grange into the next place of care or home. So it's been a capital investment, and you'll see on the Grange site. We've also invested in more teams at the front door in the Grange, be that ED consultants or multi-professional teams that are looking after acute patients with frailty. And we're also coming to the final stages of our extension to the ED waiting area, which predominantly will support and improve patient experience. It's the current facility is not no longer large enough to manage appropriately the numbers of patients and their carers through that department, but it will also give an opportunity to reorganise within the department to help flow, throughput and ultimately care. So a real priority that goes into this year. In terms of our focus on cancer and planned care, that continues. Nicola outlined some of the progress around cancer performance. We continue that this year. We've already seen this year a significant increase in demand in cancer, over 24% increase in referrals already this financial year. So really important we continue that work on looking at particular tumour sites, so how we can improve certain pathways, introducing more straight to test pathways so patients don't have so many stages before they get to that critical decision, diagnosis and decision to treat. From a planned care perspective, there's a real focus on bringing the waiting list down, some of which is supported through the additional money that Welsh Government have invested into planned care to see outpatients, and at the first start of the year to do more treatments. But we're also focusing on modernising and transforming how we deliver planned care through utilising tools such as health pathways, working with GPs and secondary care clinicians to better manage the demand and flow there. And finally, on our mental health services, Nicola outlined the big progress we made last year, and we continue that into this year with a focus as well on the estate we're providing mental health services from, and how we can improve or better organise our services to make maximum opportunities, maximum use of the good estate and address some of those challenged estate issues. Final bit I wanted to draw out from this slide is the new organisational strategy. Nicola touched on the work we did last year around engagement. We've now finalised that strategy, so Gwent 35, better health, better care, better lives. And we are already looking at how we embed that into our planning for next year already, but also we start to use it as a lever to make change, working with our communities who really contributed massively to the development of the strategy. And it's important for us we keep it alive through our ongoing engagement and service change that we seek to do. So that was all on that slide I wanted to draw out. As I said, huge amounts of detail in the plan on the website, but just to note that we're delivering those ambitions alongside in the context of some challenges that remain. We do have a number of key national performance standards we are committed to delivering our best against. That's not always to say we can achieve all of them, but how we're using our resources to best effect to maximise delivery against those. But sometimes we have some challenges in some particular areas that we continue to work on. There is a workforce challenge, whether that's about availability of workforce and retaining and recruiting staff. We have made really good progress, particularly around our nursing workforce. So we're in a really positive place, but it's an ongoing challenge across. We have some particular professions, particular specialties where there are some unique challenges experienced across the UK. And it's the management in the context of some of the ongoing pressures, how we're keeping our staff well, motivated and in work. We continue to work and really focus on that. And as Nicola said, today we approved a new people plan that will really support and give us the tools to do that, working with our staff. Resources will remain a challenge in terms of availability of and the growth in costs and pressures, whether that be due to non-pay, medicines and the cost of drugs continue to increase. So it's how we're finding opportunities within how we structure our services and any efficiencies to, as far as possible, offset or mitigate the pressures that emerge through those changes in costs. And our estate and infrastructure, again, building on what Nicola said in the context of last year, we have some great estate, but we have some challenged estate. And one of the things we're really working on this year is an investment plan for Neville Hall. We're really excited by the developments up there. We've got a regional cataracts hub. We've got a new regional radiotherapy centre, and it's now about how we get and seek and secure investment to address some of the risks associated with RAC that we have in Neville Hall, and how we can create an environment that removes that risk and makes the facility much more future-proofed in terms of future design of services. And the last thing, and again, just building on comments previously made, is how we deliver on a number of the key digital projects that we have. Digital is a key enabler for us in terms of how we deliver care and how our workforce work to optimum effect. And that there are a number of key projects and deliverables you'll see set out in the plan that will move us forward on that journey throughout the next few years. So that's all I was going to say, if that's okay, Chair, on this year's plan.
Thank you very much, Hannah, for the very clear overview that you've given us. But I would encourage everybody to read our annual plan to see exactly what it is that we are determined to provide, and for your ongoing contribution in terms of your views and thoughts to how we develop further for the future. They have been exceptionally helpful in the past, and we do look forward to receiving more of your comments, which we take very seriously and have used. That is the end of our presentation for today for the last year's performance. We now move to public questions and answers, which I shall ask Dan to facilitate as he's got the list. So over to you, please, Dan.
Thanks, Anne. So we've had 4 questions submitted prior to the meeting. We've just had another 4 submitted during the meeting. If there's any more, you can continue to submit them, or just pop your hand up if that is easier. We'll do as many as we can, but we might have to follow some up in writing later on. So the first one we're going to start, and Nicola will address this one, is from someone called Ashley. And Ashley's son has been referred to a team that's called the Failure to Thrive team. And given that where we are with society, don't you think that this should be a better name for this now? It seems unfair to the children who need support.
Yeah, so thanks, Ashley, for your question. And yes, I would agree, just to answer the question straight away, that I think we should definitely look for a better term. I can completely understand why this is seen as a negative, and the stigmatization that comes with maybe that term. It is very much referred to where in the kind of children's setting around where there's people not gaining weight. It's kind of in that context. And I think there's a growing shift across the NHS to look at an alternative terminology. Sometimes people are using faltering growth, but I think this is something we can work with parents to understand kind of what matters, what works better alongside the clinical teams. So lots of work going on, active work to update the terminology. And again, as I said, really welcome people's feedback, but I would absolutely agree that the term needs to be reconsidered, because I think we all agree with the negative connotations that comes with it. So thank you. And yes, we are working on it, and please feel, make sure you contribute to those discussions with the service.
Thanks, Nicola. We are coming next to Karen's question. Karen's question will be answered by Jennifer Winslade, who is the Health Board's Director of Nursing. The question is, what has happened to proper patient handovers, staff rooms, and general good care of patients?
Thank you, Dan. So from my perspective as the nurse director, it's really important that we have robust and well-structured handover processes. All clinical areas currently follow strict guidelines and standardised procedures for handovers, and we do use proven frameworks that have been tried and tested either within the health board or learning from other health boards. We also ensure that we tailor it to every situation. So we have formal verbal handovers. We have a handover when a patient moves between departments, and we have written SBAR documents and verbal communication. And we also know that we do that when we refer to specialist services. So that's sometimes in writing, supported with a verbal discussion. We also know with the integration of electronic patient records, that will be the future. So the WNCR helps facilitate that. But for me, it's about making sure we've got that safe handover of patient care to ensure that the next person understands the needs and the outcomes that are being strived for, any risks for that particular patient or group of patients. The staff rooms, we are committed to providing environments where staff can properly recharge, and that's both on and off ward areas. We do have very good canteen facilities, as you know, and we try to provide spaces that are calm and restorative to enable staff to get the rest during their shift and away from their clinical duties. We support ward areas and departments to maintain those areas, to make sure we've got appropriate breakout rooms, and to ensure that we've got access to those on-site coffee shops and other areas where staff can decompress. We continue to seek back on that through staff engagement sessions, and we continue to look at how we can enhance those facilities for staff to make sure we've got that healthy work environment. Just on the last part of the question, you know, as the nurse director and as clinical directors, we are all deeply committed to providing safe, compassionate care. So when we look at general care, we make sure that we work to the highest possible standards, and we have robust measures in place to make sure that we can improve. We actively listen to the voices of patients, families and staff. We ensure that feedback is put back into learning and improvement, and we make sure that we have rigorous high standards of care quality. But we don't just rest on our laurels. We look at how we improve that through quality improvement. We do a lot of work with the workforce around ward and team accreditations. So we now have a process where we audit and offer a kite mark and an award for staff who are proud of their environment, who engage in the audit process and start to look at that quality improvement. Recruitment and retention is important to care of patients. So you've heard earlier about the improvement we've made on nursing vacancies and reducing agency, because we know staff that bank and regular staff give a higher quality of care to these patients. And then just finally, I'd say that, you know, all of those measures really go to drive those standards of clinical care, that ability to improve quality and safety, and that ability to continuously improve. But we can only do that by listening. So listening element about ensuring that the voice of our patients, their families and our staff is heard, and voice is put back into quality improvements. Thank you, Dan.
Thanks, Jenny. I think we got most of that, but there might have been some signal issues. And just for people to know, we will provide a summary of all the responses to the questions that were asked on the website, and you will get a link to them using the email address that you registered with. So we'll cover that off that way. The next question is from Paula. Paula's had to leave the meeting this evening, but did join earlier. It will be answered by Nicola, the Chief Executive. And Paula asks, or says, that her husband, her husband's both hips have gone now, and they're still waiting for an operation. They have very little quality of life, and just been keeping told that he is an urgent priority, and it's because it is the Royal Gwent Hospital where you'll have the surgery that is due in the delay. Paula's struggling to get information or communication about when they might expect that operation, and says things like when they do ring the hospital, they very rarely can get through to anybody. Got stuff to add to that, Nicola?
Yeah, so thank you, Paula. And as I've mentioned, and Hannah's mentioned, this is a key area of priority. It's a Welsh Government priority as well to get those waiting lists down. And as I mentioned, orthopaedics is one of our most challenged area. We have now got nobody waiting 3 years, and we have got a few hundred who are left in the over 2-year bracket, which we are working hard to reduce. There is definitely, you know, there's concern by the clinical teams to give exact kind of timescales, because the situation changes so quickly with long waiting lists, as more urgents might be referred, clinical prioritisation, fitness for surgery. So because of those factors, there's a reluctance to be too specific about waiting times, albeit we are working about how we can give people at least kind of broad timescales with which they can at least plan their lives, for example. So we're also looking at an advanced contact centre system. So there is a point of contact that people who are on a waiting list can contact that are set up to respond to the hundreds of people who are on waiting list, and to being able to improve that support and access to information. So that's an area that we are looking at. We have been doing some work to make sure we support people on the waiting list, keeping in regular contact, but that does sometimes prove challenging. So waiting lists are coming down. We've done some work, but are doing more around people being able to contact us while they're on the waiting list and offering them support during that time as well. So thank you.
Thanks, Nicola. We are coming on to a question from Councillor Kevin Etheridge. And just to note, Kevin, we've got two other questions. One is asking for a copy of the people plan. I'll send that to you on email, so we won't pick that up here now. And secondly, ask for some more information on the buyback arrangements of the PFI contract in Chepstow. And similarly, we'll provide more information by email on that this week. But your question to be read out today is, and it will be answered by Jennifer Winslade, the Director of Nursing, is to provide the number of complaints that the Health Board is currently dealing with, their nature within the last 12 months compared to the previous 12 months. And a follow-up to that is, do you feel that the Putting Things Right service is fit for purpose, and what changes or procedures, if any, are currently under consideration?
Thank you, Dan, and my sincere apologies. I've switched Wi-Fi, so hopefully my signal will be much better. Apologies. Just before I start this, and it relates to the previous question, we are deeply committed to the improvement in quality and safety. For me, the PTR process is a key deliverable within that, because if we aren't able to understand people's experience, then we aren't able to improve. So it's really important that we understand the experience of people within our services, their families and our staff, because that helps us to improve our services and to ensure that we root out any variation in quality and safety and experience. But to your specific question, Councillor Etheridge, so we received 3,151 complaints in 23-24 and 3,119 24-25. If you compare that to our number of patient contacts, it's less than 1%, and is indication, I think, of the amount of high quality care that we do provide. So the main themes across both years were clinical care and treatment and assessment, as well as appointments and communication matters. And obviously the appointments will relate back to Nicola's response in the last question. We've been heavily involved in the national discussions and the consultation on the new PTR regulations. We're really keen to ensure that there is flexibility in the new regulations to ensure that we can respond appropriately to people, and that we can give a response that the person wants. So sometimes people don't want a formal response. They either want a verbal response or they want a chat with somebody. And the way in which the timeframes are structured currently, we only have a very small window to do that. So we're hoping that some of that flexibility will ensure we're more able to respond flexibly to people. But we have done a number of improvements. In February of last year, we brought together the resources that sat in our operational divisions and within my complaints team. So we've centralised that to create greater consistency, better knowledge retention and improved links, and ensuring that we're better able to manage responses. So we're just 18 months in, and I think we're starting to see the output of that in terms of improved responses. To note, our ombudsman referrals, our number upheld, or have significantly reduced last year, which would, to me, be an indication of the quality of our responses, although we appreciate timeliness needs to improve. We've put a formalised acknowledgement process in place. That's to try and ensure prompt, personalised contact and to be able to be really clear with people around timescales, because I think sometimes some of this is about communication. If we communicate with people, they're generally very understanding about any delays in the process or how they feel about the process itself. We've put enhanced monitoring in place. We now have better data about where complaints are in the system. And we have a senior management team who review cases twice a week with divisional teams who are investigating. We've put into place communication standards, so expectations when a complaint is in the system, how often people should be communicated and what that looks like. And obviously we work very closely with the Ombudsman and with LICE as well to ensure that we reinforce that openness and accountability. So further work to do, but significant improvements in the last year.
Yeah. Thank you, Jenny. And the last question that we've had in advance, then we'll come on to those that have been submitted today, is from Councillor Etheridge. And Councillor, in his role as an elected member, has said that he's received complaints about the waiting times at A&E at the Grange University Hospital, and that residents have been attending Prince Charles in Merthyr as an alternative because they are perceived to be seen quicker. Nicola, as the Chief Exec, have you got anything to comment on that?
Yeah, so thanks, Councillor Etheridge. Two kind of points, first of all. So because of our close proximity to Prince Charles Hospital for some of our communities, we've got a well-established long-term agreement with Cwmtaf Morgannwg. We pay them almost £20 million to look after residents of Gwent that might go to the hospitals. So if it is closer for people or people choose to attend there, then that's absolutely fine. And we monitor closely the level of attendances that go to those hospitals. And we haven't seen any significant shifts at this point, but we'll continue to monitor that. You know, whilst I understand people might go there because it's closer, it would be disappointing if I thought they went there because they thought we didn't offer timely or good care at our own facilities. And as Hannah's mentioned, we're working really hard to improve the access and wait times at the Grange Hospital. As Hannah mentioned, we've got a new transfer lounge, which helps flow of patients through the department. We've appointed 6 new emergency department consultants to help with the processing of patients because of the demand we've seen. And we mentioned the new waiting room area, which we know is often congested and cramped and not really fit for purpose with the current demand. So that is due to be opening fairly soon, which will also help patients' experience. You know, our data suggests, you know, as I mentioned, once you kind of get through the department, that we've got very good outcomes, and our waiting times and our turnaround of patients compares very well with other areas. So lots of work still to do. As you know, we've been working really hard on an initiative called Your Next Patient. It's linked to the Welsh Government's commitment to get ambulances handed over in 45 minutes. We've been doing a focused piece of work over the last 3 weeks and have seen significant improvements in the last 3 weeks, and we're working hard to try to embed and sustain that improvement, which hopefully everyone who attends the emergency department will see the benefit of. So hopefully that's helped answer the question.
Kevin, do you want to come back? Anything?
Yeah. Can I come back, Nicola, please?
Of course you can, yeah, of course.
I try not to be long. £20 million, is it value for money? It seems an extreme lot of money. And I'm talking about people from Blackwood and Ken Forest, the north of the borough, and the reason they go to Prince Charles is they believe that they could be waiting 3 to 6 hours, and if they go to the Grange, they'll be waiting between 8 and 20 hours, and that's what's come back, whether it's their perception or not. But the number of people I've spoke to, they do seem to be seen quicker at Prince Charles, and that's all.
Yeah, no, thank you. And 20 million is a lot of money, but in the context of what Rob presented, you know, the amount of money we spend on health services is significant, and it's very much supports the North Rumney communities who've got a natural flow into Prince Charles, and we make sure money follows the patients around the system where appropriate to do so. So that won't just be for A&E, that will be for outpatients, for operations, for maternity services, all sorts of services that will cover. But there's also, there is something available. You can go on a national kind of website, which tells you what the waiting times are in the different hospitals at different points in time. Again, if patients have got a minor injuries unit, then we've got some of the best performance around waiting times in Ysbyty Ystrad Fawr, Neville Hall for those populations if they don't need to go to the Grange. But obviously, you know, we treat people in absolute clinical priority when they get to the hospitals and do our best to make sure we limit how long people are waiting. But there will be probably times at different times of day, at different times of the week. I'm sure there will be a variation between the wait times between hospitals, depending how many people are in the department at that time. And the Grange is a much bigger department than Prince Charles is because we've amalgamated the two hospitals. But it's something to monitor, and people can try and have a look at what the wait times are in the different hospitals if they live fairly close to both sites.
Thank you.
Thanks
you.
both. I'm going to come on to a couple of questions from Julie Thomas. Now, Julie's on the call. I believe the first one is, can we have a copy of the slides? And yes, we'll upload them to the website where you can download them. And the second is Slice represented in this AGM? And yes, Lisa Charles is with us, who's the Regional Director for Slice. And for those who don't know, Slice is an independent body who help the people of Wales do all sorts of things around their health and social care. And then there's another question from Julie. So this one's going to be for Rob Holcomb, who's the Director of Finance and Procurement, who we've already heard from tonight. And that is, are there any concerns over the possible inflation plus costs for drugs purchases? And the example that is given is that media reports are now saying we're seeing a double price increase in Mounjaro and shortages.
Yeah, thanks, Dan. Thanks, Julie. Short answer is we're always worried about the drugs prices inflation in the NHS. It's something that's a perennial issue for us to try and manage. In terms of how drugs prices work, they're generally set nationally through the UK government through a pricing arrangement, and those prices are reflective of the innovation of new products coming to the market, if there's a clinical excellence assessment of their effectiveness that we have to then implement, and pharmacy companies are commercial companies, and prices are reflective of their investment in new products, market forces, demand, and also availability. So there's a lot of factors in terms of prices that drive drug inflation. In terms of the new weight loss drug, that has seen an increased price, particularly on the market now as it becomes available, not just through the NHS. And that's something that we are conscious of. And we've got mechanisms within our weight management service to assess the appropriateness of those prescriptions. Overall, the Health Board spends about just over £200 million on drugs, and we have seen in the new year just over a 1% inflationary and growth cost pressure emerging above our funded levels. And those areas are predominantly in sort of half and half split between our GP prescribed costs, but also some of our acute hospital prescribing services, particularly hematology and cancer, and some of our cardiology drug services that we provide. So yes, just to repeat, we are seeing a significant pressure on us. We always do each year. And we have to mitigate that in the mix of how we allocate resources. We have a medicines management program board and a medicines and therapeutics committee that attempts to ensure our prescribing is appropriate, best value, and in the interest of patient care. So yes, it's a key significant area of management from a clinical perspective for the organisation, and we do keep an eye on those aspects as well. Thanks.
Thanks, Rob. The next question from Julie is going to be answered by Hannah Evans. And the question is, can you cover how the community partners work with you as a health board on the consultations for strategy and services? There's a plethora of agencies all receiving funding to engage with the community, but many are unknown to each other.
Yeah, thank you, Julie. It's a really good question, and we think we've made really great progress in this space, but there's always stuff you don't, as agencies, as you touched on, that we maybe don't know and aren't working as effectively together. As part of the engagement we did for the strategy, so we called it a conversation for a healthy future, and As I touched on, we went out and engaged what we think far and wide. We got just under 8,000 sort of contacts, whether they be people who attended our events and or responses to surveys. And we, as part of that, we did a lot of work in one, we're collecting all the different groups. So we were going from kind of established groups, sort of maybe well-known community groups, through to men's sheds and you know, off to Rodney Parade to try and connect with different communities. But we did, through that work, really connect with our partners on this level. So an example I'd give was at the same time we were engaging, the Gwent Police, the Police and Crime Commissioner for Gwent was also engaging on strategy. And so we shared the intelligence that we were all receiving, because I think one of the things that maybe comes through in your question is, as a community, you can get asked a lot of things by lots of different agencies, and some of the challenges and experience are common across those agencies. So we've really tried hard to share that. We've shared everything we've got with all of our local authority partners. I said the Gwent Police, and likewise they shared their insight and intelligence with us too, because those themes, again, as I said, were common across some of the areas. However, you know, as I said, I am sure there are groups out there who are doing similar work, and or I think in your question you say about who are funded to engage. So I'd be really keen to just to like link in, if that's okay with you, to just cross-check our list, to check we've got everyone connected, because we've built up now this database of communities with whom we now engage. And Karen Newman, who's on the call, in terms of our Associate Director of Comms, has got a team who go out into the communities as well, but there'll always be groups that we haven't quite connected with. So I wouldn't say we've absolutely nailed it. In terms of services specifically, previous comment, we talked about Llais. Our colleagues are on the call as well. We work with them very closely if and when we are considering, or we have a service challenge and we're considering options for improving. So we work with Llais on how we're going to approach that, and Llais will sort of keep us straight in terms of robustness of process, help with the language of the documentation, and then support in terms of a report and output from any engagement. And an example being an engagement we've done recently around the Neville Hall challenges but opportunities in terms of investment I touched on in my section. So we think we've made a lot of progress through the work of the strategy and our service changes, but there is always more to do, and we're always keen to learn and keen to connect with whichever groups are out there we may have missed. So happy to pick that up offline as an action if that's helpful.
Yeah, thank you, Hannah. We've got just 3 questions left. One of them is from Rhiannon. Rhiannon says that recently bank has been cut back for community. And by bank, we mean our resource bank, which provides temporary short-term work placements to support the workforce, and the community being the community teams, but who are short-staffed due to sickness, and staff are having to do up to 15+ calls a day. I think we need some more information on how we can look into that. So Sarah Simmons, who's the Director of Workforce, is going to contact you to find out exactly what's going on there. So we'll be in touch offline to find out some more details, if that's okay. So we're down to 2 questions. The first one is Julie Thomas's last one, and I wonder, Nicola, that if you could give us a little more information on emergency mental health services, please. Is anyone monitoring the 111 press 2 line, and when can we see a copy of the new mental health strategy for sharing with the community?
Yeah, thanks, Julie. So we are closely monitoring the 111 option 2, because obviously this is a really important development for our mental health services, and we have got published data on that. I will get an up-to-date position on that and happily share that. We'll post it on the as part of the questions here and the answers. I haven't got it at hand, but we will show kind of the trend as well, and where we're at the minute around option 2. The mental health strategy hasn't been developed yet. It's kind of in the process of its development, and there'll be a lot of engagement work being done as part of that, so that kind of patients, community, service users can contribute to the new strategy. If there's anything more specific on emergency mental health services or crisis services, because obviously there's a number of components, then we can happily share that with you and give you a fuller briefing outside of the meeting, if that's okay. But thank you, really important topic, thanks.
Julie's just shared her contact details, so I'll pass them on to the people as opposed to publishing them here. So we'll pass them on to the people who are going to contact you. And lastly is a question from Francesca, and this is going to be directed to Dr. Andy Bagwell, who is the Interim Medical Director for the Health Board. And the question is, are there any service improvements that the Health Board has pioneered that you believe could set a standard for the wider NHS?
Thank you very much, Dan, and thank you, Francesca, for the question. I'm particularly proud as Medical Director of our Interventional Radiology Service. I think it's important to understand that they are consultant radiologists who have a particularly specialty in placing quite long needles into patients' bodies to get very specific results and treatments. We have a particularly strong group of consultants in this arena, and we provide a service that's almost unparalleled in Wales in terms of the services and treatments that they offer. But they've gone above and beyond that. They've done a big research enterprise allied to one of the London hospitals, and we're one of only 2 sites in the UK to have undertaken an exercise called geniculate artery embolization. And the purpose of this, the geniculate artery is an artery or a blood vessel that supplies the knee. And for those patients who have fairly awful osteoarthritis and knee pain, it actually rids the knee, or the patient rather, of knee pain for a number of years, and it reduces the burden on our need to perform joint replacement, or so total knee replacement in patients, and provides them with another couple of years of pain-free walking without the need for joint replacement. The results of those interventions have gone into a sort of worldwide study. So we are at the forefront of that, which is a bit of a surprise for a health board in Wales. I think you probably agree. You usually see it in only the very big research-led centres, either across the UK or the US or Australia as well. So I think that's a huge feather in our cap that we've been able to offer that treatment to a number of patients, partly as a research exercise and partly as a fact-finding exercise in terms of improving our internal services as well. And allied to that, we've also just purchased a robotic arm to use in that service as well. So I suspect many patients are very used to our use of surgical robots, but this is one of the very first radiology robots that does a similar sort of role, but it reduces any risk of tremor in the operator's arm. So the results we get by placing our needles into patients' bodies, which sounds very dramatic, but it's far more safer than our previous sort of human-led needle placements. Even those are very accurate, and we use digital imagery to get the placement of those needles correct. We've now adopted a robotic arm, which has been very successful so far. We've only had it 3 weeks, but I think this is an innovation and something we're going to see across the UK over the next couple of years as we sort of become more heavily reliant on robotic solutions to our interventions, for want of a better word. But great question, and I'm delighted to be able to answer that so positively. So thank you.
Thank you, Andy. And we've addressed all of the questions put to us. So that's the end of this section.
Fine, thank you very much. And thank you all of you for your really helpful and interesting questions. Just to close the AGM, I do hope you found this AGM has been useful in an arena in which you can hear the ways in which we've tried to improve our services, but also the problems with which we are struggling. We're very, very grateful to our staff's commitment to provide good quality care, but also the enormously helpful feedback you provide to us, which enables us to really think differently about the care we provide, and to your support to enable us to improve further. We hope that we'll be able to maintain our progress and continue to develop our services for you And a particular emphasis will, over the next 5 years, be on really ensuring that you live a good and healthy life with our help and aid and encouragement. So we wish you a healthy and thriving year, and we look forward to seeing you again, either at our board meetings, which are every 2 months, or at our next AGM. So please keep well and safe and have your vaccination. It would be incredibly helpful to you and to us. And we look forward to seeing you again. And thank you so much for your involvement and your interesting questions and interest. Thank you. Good night.